Hi, welcome to the session. In this, we are going to cover the topic of cholesterol and the coronary artery disease. You'll learn about how the plaque gets formed within the arteries and the clots and the potential heart attack scenarios. As you can see, the coronary artery disease, or CAD as in short form it's referred to, occurs inside the lumen, which is the inner wall of the arteries. And as the coronary arteries get narrower over time with the increased deposit of plaque, this inherently limits the flow of oxygen rich blood to the surrounding heart muscle tissues. And atherosclerosis is the process wherein the plaque deposit happens into the arteries, thereby reducing their size, I mean the inner blood flow purpose, and the thickening of the walls around the lumen, and then the plaque further getting deposited and built up over time can lead to the complete blockage of the artery as well, and this could be the potential cause for heart attack. Now, how are clots formed in the arteries? Let's understand this aspect. As more of the foam cells, which is part of the lumen and the surrounding subspace, this gets collected in the artery wall as a fatty streak initially, and then over time develops between the intima and the media, as you can see. And basically, it's around the inner walls of the arteries. And if it is not stopped early enough, this streak of foams would essentially become plaque, and which gets into the intima, into the lumen, and narrowing of the blood. So essentially the inner walls, it will get deposited, and over time the wall gets thickened, and it would make the nerves brittle as well. So that is how the buildup happens, and it could lead to the clot and eventual rupture also of the arteries. The disease often begins when the LDL, or the bad cholesterol, gets deposited into the artery wall, and the body has an immune response to protect itself, and then tends to send some white blood cells, WBCs, called macrophages, to engulf the invading cholesterol, and they, over in the interaction, form the foam cells, and it's typically based on the appearance this name is given. How are clots formed? Now, further, if we look into the plaque that gets deposited, develops a fibrous coating on its outer edges, and with time, the cholesterol continues to collect in these foam edges inside the plaque, and the fibrous outer coating would weaken because of the continuous pressure and the buildup of the plaque that's happening from inside, and eventually rupture, and this would create a block on the downstream arteries. So this is one of the core reasons that the potentially poses a very high risk of the cardiovascular diseases or heart attack as well. And over time, if this is not addressed, the clot may get developed at the rupture site and completely block the downstream arteries as well. And that's a huge issue then to deal with, because there are several medical conditions that need to be addressed. What is unstable plaque in the fibrous cap? So this large unstable plaque is basically the thin fibrous cap that would exist, and this formation over time could lead to more and more plaque buildup around the inner arteries, and thereby narrowing of the arteries for the normal blood flow. And because lack of oxygen rich blood not flowing through, it would have the adverse impact and create a medical condition. Now, the blood clot, how does it happen? So, this myocardial infarction of an the common name is heart attack, occurs when the muscle tissue does not get the vital oxygen and the nutrients that needed. And since blood is the carrier of the oxygen for various now the vital tissues, so it becomes imperative to have a unchoked or clean arteries, and so addressing of the plaque getting deposited into the arteries is a core issue to be addressed. So a blood clot, essentially referred as thrombus, forms at the site of this plaque deposit and the rupture that is happening. And the heart muscles, which is essentially referred in technical jargon as myocardium, as a supply by the blocked artery start to die, and this is basically another medical condition that is unwarranted. So this gives you a perspective on the core aspects of coronary artery disease and a better understanding how it is forming in light of the plaque that is forming initially and the subsequent steps. So for more information you could contact onto this website, and thank you very much for your attention and look forward to see you again. Thank you.